My name is Summer, and today Emily and I are going to talk to you about the importance of knowing your numbers. So here we have a diabetes self-care checklist that we want you to take a look at. You can pause the video to get a closer look at it, and this checklist is also available at the pharmacy if you'd like to get one the next time you come in. So each item on this list is something that should be completed regularly to get better control and to prevent complications in the future for patients with diabetes. And completing this checklist will give you an idea of what you are already doing to take control of diabetes and the areas in which you can talk with your doctor about to set goals and make a plan. Today, we're going to talk about each of these items in further detail and why each one of these are important. So, do you think you check your blood sugar as often as you should? Most people's response to this will probably be no. Checking blood sugar often or multiple times a day can play a large role in helping to control your diabetes. Checking it before or after a meal or exercise helps you to recognize how certain foods or exercises will affect your levels. So by checking both before and after, it can help you to avoid any period of low or high blood sugar. So how do you know if your blood sugar is low or high, and what is the target goal range that you're looking for? So here we have a blood sugar chart that has goal ranges. These ranges are all recommendations from the ADA, which is the American Diabetes Association. Although these are the standard recommendations, your specific goal range should be determined by you and your doctor. But these standard ranges include for fasting, which would be 8 hours of no eating, the recommendation would be 80 to 130. So 2 hours after a meal, it should be your blood sugar should be less than 180, and your goal A1C should be less than 7. So with that being said, yours may differ slightly from these numbers, but you should always make sure that you follow the goals that are specific for you. So whenever you get ready to test your blood sugar, what supplies do you need? As you can see in this picture, we have the OneTouch VerioFlex monitor, a lancing device, and test strips and a lancet. This monitor is pretty easy to use with its color-coded range, as you can see on or beneath the screen. And whenever a test strip is inserted into this monitor, it powers the monitor on and indicates that it's ready for a blood sample. Once the monitor gets the sample, the screen will present your results, and it will have an arrow indicating where your blood sugar falls in the color code range. So blue, if there's an arrow pointing to the blue, it indicates a low blood sugar level, while red indicates a high blood sugar. And most of the time, the color green is usually associated with something that means it's good or okay. So if you're in the green range, then your blood sugar is good to go. For the lancing device, the lancet will be inserted into this device, and then this is what will be used to obtain the blood sample. But we will demonstrate how that works later on in this presentation. Also, we have alcohol pads and Band-Aids on the list, so it's always good to have these two on hand for the alcohol pads to disinfect your finger and Band-Aids just in case you bleed. But we will demonstrate how each of these are properly prepared and used later on. So what is the proper technique for testing your blood sugar? So we're about to show you a video demonstrating the proper technique for testing blood sugar. Emily will explain each step as I demonstrate, and then we want you to pay close attention to the results that we get whenever we check my blood sugar.
Okay, today we're going to show you the proper way to test your blood sugar. So first you're going to want to wash and dry your hands thoroughly, and then you're going to set all your supplies out ready to use. So first we have the glucose testing meter, which is right here, and then we have the test strips, and the lancing device, the lancet, and the test strip that's already out and ready to use. And then we've got an alcohol swab and a Band-Aid. So first, we're going to get the lancing device. We're going to remove the cap. Okay, and then we're going to get a lancet. And it's important that you never reuse the same lancet. You can always get a new one. So first you're going to align the lancet into the device until it snaps into place. And then you're going to twist the protective cover one full turn until it separates from the lancet. Next, you're going to replace the cap, put it back on the device, and then turn clockwise to secure it. Next, you're going to adjust the depth setting. This is at the bottom, and there's numbers 1 through 7, and Summer is going to use 6. Okay, and then you're going to cock the lancing device by sliding that little piece down, and it should click. All right, and then we're going to insert a test strip into the glucose meter. Okay, and the silver prongs should go into the device. And this should make it turn on like it did right there. And then the flashing little blood drop should come up. So now it's ready to have a drop of blood. So first, to prepare your finger to be pricked, you're going to want to alcohol swab it. Then you want to let it dry just a little bit. Okay, now it's ready to be pricked. So just press it into your skin a little bit on the side, and then press the button. And then to get a drop of blood, you can do what Summer's doing. Okay, and there's a drop of blood, so you'll use the side of the test strip to collect the blood. And it should fill in the whole thing like it did right there. And then there's the results. Okay, and so now you're going to you can put a Band-Aid on your finger. And so for the lancing device, you're going to want to discard the lancet that you used. So you'll remove that cap. And then you're going to want to put the cap back on the lancet. And then remove that and discard it in the appropriate bin. So we have a sharps container, we'll put it in. And then you'll put the cap back on. And then you will take the test strip out of the device and discard it in the appropriate bin. And then you're all done.
So now that we have demonstrated the proper technique, we're going to talk about why each of these steps is important to do. So why is it important to wash your hands and use an alcohol swab? So think about all of the objects you touch throughout the day. Your hands come in contact with countertops, door handles, pens or pencils, and each of these objects is covered with germs and bacteria. So this picture on the right shows the amount of germs and bacteria that our hands have on it. And if you pay close attention at the green area, especially on the tip of the finger, which is where you get your blood sample from. So that's where there's the most bacteria at. So if we don't wash our hands before breaking the skin, whenever you prick the finger, it allows this bacteria to enter your blood, which can lead to an infection. So that's why it's important to wash hands well to remove the bacteria before pricking the finger. So we also want to clean and wash hands to remove the contaminants that are on the hands. So contaminants may include anything from dirt, sugar particles, or any other object that might be on the hand. So if your hands aren't clean, then these sugar particles may enter the blood sample whenever you prick your finger. So whenever these sugar particles enter your blood droplet, it may distort the reading and cause your results to be falsely elevated because you're going to have extra sugar besides what's actually in your blood. So not only do we want to use the soap and water to wash hands, but we also want to use an alcohol swab. Using the alcohol swab after washing your hands, just make sure that the area is disinfected well and make you know that the test site is clean then. So using a lancing device is very important. The lancing device is, as you can see in the video, this is what is used to prick the finger and obtain a blood sample. So the lancet, which is a very tiny thin needle, is placed inside of the lancing device. And then after each use, you always want to make sure you remove the used lancet and insert a new clean lancet before the next use. So not only does reusing a lancet put you at an increased risk of getting an infection, but if it is reused multiple times, then this needle is already a tiny needle, so it becomes very dull, and whenever you use it to prick your finger, it would be more painful than what you would usually, or what you would experience if you had a new lancet. We also want to avoid using any other sharp objects, such as a needle, safety pin, or even a knife to get blood samples. Not only is this more painful for you, but these objects all have the potential to have multiple different bacteria on them, and they can be nasty, so you don't want to stick this in your finger because it will increase the risk of an infection. So you always want to remember to replace your lancet and use a lancing device whenever you get ready to get a blood sample. So as you saw in the video, we talked about the proper removal of the lancet and disposal of both the lancet and test strip. So you always want to save the cap on the lancet and dispose of it in a sharps container. So in disposing of it, we want to make sure that we save the cap that we removed from the lancet, and as you can see in the video, whenever I saved the cap, I demonstrated how you would recap the needle before disposing of it in the sharps container. You want to recap this needle so that the tip is covered and it's not a needle that's just freely floating around. So to recap it, you place the saved cap on the countertop and then push the lancet into the cover like we demonstrated in the video. But you don't ever want to pick the cap up and push it into the needle with your fingertips, because then you risk shoving the needle into your finger by accident. So after the lancet is properly capped, then your lancing device usually will have a trigger on it. In the video, you saw me push up on the trigger and it pushed the lancet out of the lancing device. So whenever you slide this trigger up, it should eject the lancet from the lancing device. And then it should be easy to remove. And once you remove both the lancet and the test strip, then you want to make sure it's disposed of in an approved sharps container. So earlier we asked you to remember my results and where it fell out on the color-coded range. So my blood sugar was 131, and this was because I had just eaten a small Kitkat. So I would say that I ate the Kitkat just for this this demonstration, but to be honest with you, I just really wanted a Kitkat at the time. But from this small piece of chocolate, we saw that it had my blood sugar levels slightly elevated, and that goes to show that even small pieces of candies can cause a big change in your results. But whenever I say small, this was the tiny Kit Kats, like the snack size Kit Kats. So it just really shows what even a small piece of candy can do to your blood sugar. But with that being said, do you know the difference between hypoglycemia or hyperglycemia? And do you know what to do if either of these were to occur? So a good way to remember the difference between hypoglycemia and hyperglycemia, always remember that hypo means low, so hypoglycemia would be low blood sugar, and then hyper usually means whenever Or whenever you think of hyperglycemia, think about your kid. Whenever your kid's all hyper, they'll be jacked up. So just think about whenever you have hyperglycemia, it'll be jacked up, so your blood glucose will be high. So like we just talked about, hypo means low. So hypoglycemia is whenever your blood sugar results are less than 70. Some signs and symptoms of low blood sugar include you might feel shaky or sweaty, and you might become dizzy all of a sudden. You'll have a sudden behavior change, or you might become very hungry. You might feel nervous and tired, and you might have a headache. So if your blood sugar is not treated, then this can become severe, and like that dizziness and weakness can lead to you passing out. So just remembering these signs and symptoms can really help you to know what's going on in your body, so you can treat yourself if you are experiencing a low blood sugar episode. So to treat hypoglycemia or low blood sugar, you always want to remember the rule of 15. So the rule of 15 is whenever you eat 15 grams of carbs, you wait 15 minutes, and then you check your levels again and then repeat if you need to. So if it's less than 70, you would repeat steps over again, but if it's greater than 70, then you don't need to repeat the steps again. So 15 grams of carbs can include 4 ounces of orange juice, half a can of a non-diet soda, 3 to 4 glucose tabs, or a tablespoon of sugar or honey. So you want to eat or choose one of these carbs to eat, and then you want to wait 15 more minutes and then check your level again. So if it's less than 70, you would repeat these, but if it's greater than 70 at this point, then you want to eat a small meal or a snack to prevent the low blood sugar episode from reoccurring.
Okay, so hyperglycemia. Hyper means high, so it's when your blood sugar is greater than 130. And here's just some signs and symptoms that you'll look out for high blood glucose. So you'll feel very thirsty. You need to pass urine more than usual. Feeling very hungry, sleepy. Your vision will get blurry. And then infections or injuries heal more slowly than usual. Okay, so to treat hyperglycemia, medication adherence is very important. So properly taking your medications plays a huge role in staying healthy and controlled. By not taking medications as you're supposed to, your blood sugar levels can fluctuate and you may have episodes of high blood glucose levels. So if you were to take the medication each day as you're supposed to, it helps to maintain your blood glucose levels and prevent those episodes of hyperglycemia. So some ways to increase your adherence would be like reminders on your iPhone, on your phone, pill boxes, or even help from your family. A healthy diet is also very important. So if you eat a lot of carbs, these carbs break down into sugars and cause high levels of glucose in the blood. So eating a healthy diet that consists of less carbs will help to control your blood glucose. Portion control also plays a big role in healthy diet in the case that someone does not want to cut out carbs. Exercising regularly is also very important. So it's recommended that one exercises 60 minutes a day, at least 3 days a week. But if you're not able to do this, some exercise is better than no exercise at all. We just really want to reduce the amount of time that you are sitting still. So if you find yourself sitting still for a long period of time, it's just important to just get around and you can get up and clean the house or just walk around the house with your dog. Just get up and get moving. Okay, so some key points that you want to remember that we've already talked about are always wash and dry the hands. Never reuse the same lancet or test strip. Be sure to always discard lancets into the appropriate container. Always keep your meter and supplies with you. And then you want to prick the side of the finger, not the pad. And this is important because on the pad of the finger, there's more nerves, so it'll be more sensitive and maybe hurt worse. And then always remember the rule of 15 when you're wanting to treat your low blood sugar. Okay, so what are some complications that can occur due to uncontrolled diabetes?
And then what can you do to help prevent these? Okay, so here's just a diabetes care checklist. So this is just a list of things that need to be checked regularly, and then I'll go into these in depth on the next couple of slides. Okay, so to help prevent these problems, you'll want to get your A1C level below 7%. And then blood pressure. Most patients with diabetes also have high blood pressure, so it's important to keep the blood pressure controlled by being adherent to your medication and monitoring your blood pressure to be sure it stays less than 130/80. Cholesterol is also very important to have checked annually. And then immunizations. So with diabetes, your immune system is very weak. So it's important to stay up to date on your immunizations to help fight off infections. So be sure to get your flu shot every year and talk with your doctor about getting a hepatitis B vaccine and then pneumonia shot. Okay, so the teeth. It's important to get regular dental exams. So every 6 months, because poor blood sugar control increases the risk for gum problems. Periodontal disease is the most common dental disease affecting diabetic patients. So that's this picture on the left. And as you can see, if you get periodontal disease, as you get to the advanced stage, you can even lose your teeth, which you do not want to happen. So always remember, go to your dental appointments. For the next 3 pictures on the right, what do you notice that these 3 pictures have in common? It's the blood vessels. So each of these pictures, they have blood vessels in them. So for the top left, we have the eye. So when I'm talking about all of them, so uncontrolled diabetes can cause major damage to the blood vessels due to excess glucose in the blood. The blood vessels are extremely small in the eyes, feet, and kidneys, and when this glucose travels through the vessels to these organs, it causes damage because it's a very large crystal trying to travel through a small vessel. So when it's continually trying to do this, it's slowly damaging these vessels. So when these small vessels are damaged, it causes reduced blood flow to the organs. So starting with the eye, so in the eye, this damage can lead to the loss of vision or even blindness. So it's important to always get your annual eye exam. In the feet, the loss of blood flow to the nerves causes the nerves to die, which leads to the loss of feeling in your feet. This can also occur in the hands. This is why it's very important to always check your feet for cuts, blisters, or cracks. It may help to do this when you get home and are taking your shoes off at the end of the day. In someone with diabetes, wounds and infections are already slower to heal, so if a cut goes unnoticed, it could lead to a very serious infection and potentially even amputation if it's not treated. So this is why it is very important to check your feet daily. The kidneys are a vital organ to our bodies. Their function is to filter our blood. So whenever there is a loss of blood flow, the kidneys get damaged and can no longer filter the bad things out of our blood. So this is why it's important to have your kidney function checked annually. Okay, so your goal A1C level should be less than 7%. Okay, so how do you keep track of your numbers? Okay, so this the icon on the left is the OneTouch Reveal app that goes with your glucose meter. It connects to the glucose meter, so your numbers will automatically go to the app on your phone. It'll help track your blood sugar patterns that you can put, and you can also put in the food that you eat, and then you can track your activity and steps, and then you can also log the amount of insulin you use at each dose. It'll color code your levels and track the patterns by connecting specific levels with food, insulin, and activity. You can also set reminders to take your medication or even a reminder to go exercise. It'll keep a history of your blood glucose levels and highlights when you have been repeatedly out of range. And then if you prefer pen and paper, you can just get a notebook or a journal and just manually log your blood glucose levels. The Glucose Buddy is another app you can get on your phone, and it's basically the same thing as the OneTouch Reveal, except for it does not connect to your glucose meter. It's good for those that do not have the OneTouch Reveal blood glucose meter. And here's just a screenshot of what the OneTouch Reveal app looks like on your phone. Okay, have you set recent healthcare goals with your doctor? Okay, here's another handout that you can get from the pharmacy. This handout is a good recap of everything we have covered today. It is a great tool to help you track your goals that you would like to accomplish, how you plan to meet those goals, and your progress along the way. Having an action plan is always important and can be very helpful in controlling your diabetes. Any questions?